So thank you for coming today. Today's workshop is actually, like the title says, more smart jobs other than teaching that you haven't heard much about in education. So because mainly when everybody's thinking about education, the first thing you think is teacher. But today I'm going to tell you like what are the options other than teachers. So I'm going to start with introducing myself. So I'm Irene. I am I have been in this field for about 10 years now, maybe. So it's all started when I was, go back to original. So it started when I was in high school, just like you are, figuring out what I want to do. I have no clue what's the future for myself. Then I went to the job coaching for my high school and asked her about what should I do. She recommended me to go to a teacher cadet program. It's a fancy word, basically. You're basically the assistant for the teacher in a kindergarten classroom. I was like, oh, maybe I'll try that out. And needless to say, I didn't know the class was actually a special ed class. So I walked in, and this was when I was like 15. So try to have a conversation with an 8-year-old and be like, hi, I'm Irene, what's your name? And at that point, the 8-year-old was tangerine, couldn't formulate a sentence, and didn't even give me eye contact. For me, that was an eyes wide shut experience for myself, okay? Because with my experience, I couldn't experience anyone who couldn't even have a conversation with me. So that brought me to be like, oh my God, there are other people in this world other than what we associate as normal. Then I was looking at a teacher, like he was actually a instructor at CCC, which is a community college in East Bay. And he gave up his job, transferred himself into this special ed classroom teacher because he believed in there's more help that's giving out there. So that for me was like, oh my God, I had so much respect for that teacher. So then moving to college, I always want to know I will be in education field. So I do a lot of like seminars. I work with Berkeley High School students who are at risk getting their GED. Are you guys familiar with GED program? That means like students who doesn't go through the diploma route. They graduate with like equivalence degree. So then I graduated at Cal with a undergrad in psychology and minor in education. Then I'll be like, okay, now what do I do? So I got myself into a paraprofessional position, which I will explain to you guys further what is paraprofessional. So in Oakland Unified School District, who has experience and probably heard about Oakland? But Oakland is probably one of the least pleasant school district you can imagine of. So, and I got in, and then like I also become like their emergency credentialing teacher right away because they don't have enough teachers who want to do this. So the first class I got in is actually an emergent inclusion classroom. So where the teacher was leading the classroom with half students who are regular, half of them who are like in special needs. So I did that for a year, and I realized, okay, I have decided this is what I want to do. But I need more education than just an undergrad degree. So I went to Harvard to get my grad school education in Master of Education at Harvard, and come back with like a teaching credential, then realize, okay, I am still dedicated into special ed. So I was in special ed teacher for the remainder 2 years after I came back to California. Then that started off the 8-to-4 jobs. Then I realized I don't really want to continue to do the 8-to-4 jobs anymore. So I switched myself to a non-public agency. Currently I'm at ACES, which is a non-public agency primarily working with kids on the spectrum and autism. Thank you.
So we can save her voice.
Okay. And got my BCBA, which is for Board Certified Behavior Analysis, and which is something I will also describe to you later. But overall, I just want you to know a little bit about myself. And now that's the time I want to know something about you. So who can volunteer, tell me, maybe just, I've just put it up like, hello, my name is, if you that's all I want to do, that's fine. So, anybody? Like name, what year you're in school, and mainly tell me what's your experience in education, like what kind of jobs, you know. Thank you. You will use the microphone.
你可以讲国语吗？
Sure.
太好了，他可以少录一点脑袋。我叫 Fanny，
你好。
year in school， which school？
这其实是给他们的了。They're in high school, so I just want to know are juniors, seniors.
I graduated from San Francisco State. I have a bachelor in finance.
Oh, cool.
Yeah, cool. I never done anything about finance. The experience in education. I've been teaching Sunday school since I was at college.
Oh, wow.
Yeah, and then let's see. I have two kids. My daughter has minor learning disabilities, so I got used to volunteer at elementary school. I love kindergarten. Yeah.
Cute.
Yeah, they're very cute. Job in education that you know. Oh, experience. Okay, I'm currently studying at Dianza College in Child Development Department. I want to get a certificate called Early Education.
Early childhood.
And it's called Early Intervention Special Education. Okay, I want to pursue for this certificate. I just don't know what I can do with the certificate. Yeah. And job.
That's it. Now, what brought you here today? You just want to know more about.
Yeah, I can study at school. I just don't know what I should do with the certificate, and I want to know more about the field. And I'm volunteering at Angel Law.
Oh,
yeah.
Thank you. Thank you so much. Anyone? Don't be shy. No, nobody. Okay, the parents are more in this weekend, so yes.
Can I stay here?
Oh yeah, sure. If that makes you more comfortable, definitely.
Well, I also in education I teach adults, many immigrants English as a second language.
Nice.
11 years. And today, what brought me here is my daughter Monica. She always has a passion for children since a very young age. Started a babysitting business very young. And she said she wanted to help her Angel Love. I thought, well, after she had experience with special ed children, autistic children, maybe she will know how difficult it is to help. And then, on the contrary, her passion grew stronger, and she's even considering getting into this field as a profession. And so I think, wow, if she's that serious, I better come today to find out more about this profession.
Wow, thank you. That was really good. Okay. Yeah, Monica, what year are you in school right now?
I'm a junior.
You're a junior, so just think about future, right?
Yeah.
So like what major you should get into college, things like that, which we're also going to. So if you guys want to, oh, by the way, I forgot to mention, this is a very fluid seminar, so anytime you have any question, please feel free to raise your hand, interrupt, make comments, however you guys want, okay? So next thing is teaching the only job in education? Obviously, the seminar talks about the answer will be no. Teaching is not the only option, and many occupations in special education. So, even though myself was a special ed credential teacher, I let alone knows there are a lot of things out there that I wasn't aware of before when I was in your age, basically. So, I want to go over into what is special education. So, in general, therapy and intervention designed for students with special education needs. Well, that's really vague, right? Let's go into a bit more detail. Special needs including, I'm just going to read off this, specific learning disability, speech or language impairments, mental retardation, emotional disturbance, multiple disabilities, hearing impairment, orthopedic impairment, visual impairment, autism, combined deafness and blindness, traumatic brain injury, and other health impairments. Whew. Okay, long list. So, what's your definition of special ed then? Wow, you guys are really quiet. Okay, so what's my takeaway message from reading all this chart? It's basically the core value of special education when I read all this list means diversity and individualization. I show a picture of what a special day class look like. Basically means that under education, we serve all kids with any learning disability they may encounter, including physical disability, mental disability, and autism, my field, is only a small part of the special education. So I want you to take away that the most important thing for special ed is everybody is different. Okay. And there are different settings of special education. I separate them generally by two groups, but I don't want you guys to hold too much on it because there's a lot overlapping. The first part is government-related field, which is the school setting. There's public school, there's private school. There's also institution and also group homes that people don't hear much about. Under private sector, there's MPA, which stands for non-public agency. That's basically what my company stands for. So if you work with a company, like a private business, that will be considered as an MPA. There's also non-profit organization, NPO. They basically they sustain themselves by getting donations, but they're not working this for profit. And I think Angelo's is probably one of the NPO, nonprofit organization that you guys are working right now. So, under different sector, there's occupation under special education. The first part, as I say, under government related, there's speech pathologist, occupational therapist, mental health specialist, administrative, paraprofessionals, workability program manager, behavior analyst. Those are the ones that I highlighted, which I'm going to detail of. So I know it's a little bit small, but each slide, each occupation will be explained further. So on the private sector, there's behavior interventionist, music, art, drama therapist, speech pathologist, occupational therapist, physical therapist, behavior analyst, and mental health specialist. As I say, some of them do overlap in between, but I'm going to explain to you what, if you're in school district, what you're going to do, if you're in private sector, what that looks like for each, okay? And if you guys have anyone that you want me to touch on in particular, please just shout out, okay? The first one is a speech pathologist. And have you guys, I don't know, in your high school, do you guys have a special day class? Have you guys seen speech pathologists working with students before? No? Yes? You say yes. Okay.
My daughter, her IEP has speech therapy. So the speech pathologist is the one who works with her? Okay.
Yes, exactly. Typically for special ed students, it's pretty common that you have speech delay and motor skill delay. So the first one is speech pathologists. They are the one who treat individual who has difficulty struggling with communication, problem associated with the voice, fluency, language, and speech. For example, for us, saying a word is very simple, but actually speaking is require a lot of your motor planning, your brain function, and your tongue has to work with you. So for the kids on the spectrum, they may not even formulate the word ah. So we're starting from the basics. This picture is showing the teacher the speech pathologist trying to work with the student's oral muscle. Just pronounce the simple sound. So, and maybe conversation exchange. If you guys volunteer with special needs child here, you probably see some of them don't even give you eye contact. That's pretty common. and that's something a speech pathologist is also working on as well. So, and the next one is occupational therapist. Occupational therapists, what they do is they target your gross motor skill and your fine motor skill. Gross motor skill, as we say, like for typical people, you have no problem hopping. You have no problem jumping. You can self-regulate it yourself. By saying that means like you don't need to hand flapping. Have you seen a lot of kids who do hand flapping, spinning? That's because their body doesn't know how to regulate themselves. So what occupational therapists do is they train you how to self-regulate. They also work with you on your motor skills. A lot of kids on the special needs child, they don't know how to. They don't have the core muscle to help them even grab a pencil and write it legitimately. So those are the things that like occupational therapists work on with them. And they also work on like simple just jumping, swinging, hopping, moving forward. All those simple things that you think for us is very typical, for them it requires a lot of repetition. Occupational therapist usually works in a really, really cool room. So if you like something like this will be a really good environment for occupational therapists to work on. Has to be like blank spot with a swing, they can do a lot of movements about. So if you like working, getting on your feet in a big environment, occupational therapy is the right thing for you. The next one is drama, music, art therapist. So this is a little bit special. What they do is they use their own technique that say like, for example, this picture shows drama therapy. A child with special needs may not know how to express themselves to you. Even if you're the most simple thing like, why are you crying? They're not going to be related to you. They don't know why. However, if you give them a mask and acting out what happened, they may be able to express you in that way. It might be easier for them to relate to you in as a third person. So what this drama, music, art therapy does is that like they use their own techniques to facilitate personal growth and promote mental health. It's basically an alternative method for clients to express their own feelings, emotions, and in a more artistic and social norm way. For example, like if you see Picasso, people say like, this is the one that like I have the least experience of because I'm never an artsy person myself. So if people say like, oh, if you see Picasso, you'll see so much emotions inside. And I'll be like, oh really? I went to his museum and I didn't get any of that myself. But that's the whole point. If you have, I'm pretty sure you guys have special talent, like you probably join your drama school in class and things like that. If that's a passion for you, you can make this become one of the jobs for yourself, okay? Because there's a lot of people out there who can work like this. My cousin herself, she's a drama therapist in Taiwan, and she said there's a lot of needs there right now. So, same as here, there's so many different, I've just named a few that's like art related, but there's also like horseback riding therapy, like you name it, there's something out there. So if that sounds like something you're really good at and you want to help kids with this way, that's another way to go. Okay.
Question.
Yes.
How does music therapy work?
How does the music therapy work? Okay, have you been into the way it works is like they have something called listening center. For example, you will see like a lot of kids like putting on their headset and they play not only classic music, but whenever I heard it's mainly like a classic music. While they're listening to music, they work on like communication. They still work or they read a book. The idea of the music therapy is that like you can calm yourself, your mind can processing while you're listening to those soothing sounds, and you actually have a better way to learn yourself. And it's also part of the self-regulation skills they're teaching you. Whenever I was meeting with the students in the listening center, I was really amazed because like it seems to be like they're listening, but they can still formulate a conversation with you. Like, what are you listening at? They're like, oh, I'm good. So like, it's interesting. Like they're, especially kids on the spectrum, their mind seems to be working as like a parallel path. So there's one that they are listening to the music, but the other way their brain is still formulating. So that's what the music therapy does. And mainly I listen to, like, I think there's a specific way, like if you feel this way, you have to listen to this type of music. But in terms of detail, I think you need to be related in the music field in order to know that. I'm unfortunately not a music major myself. For example, the next one is physical therapist. They are different from occupational therapists because they mainly work on your mobility. When I say mobility, is those who are not able to stand up themselves. For example, someone who got a traumatic brain injury after a car accident. Someone who fell, someone like this girl right here, she's working on how to walk by herself. That's what physical therapists do. So they work with all variety of ages. Someone maybe from birth cannot work because their core muscle is not supporting them. And all the way to like adulthood, elderly. Elderly, like you will see physical therapists work with elderly a lot because as they get older, their mobility become very, very limited. So that's what they're trying to work with them on. Like you can still navigate around your whole house by having extra support. So they help you with perform functional activities as well as like in their daily lives. The next one is mental health specialist. So do you guys know if you guys have like a school psychologist on your campus? Yes? Someone says yes, someone says no. Okay, so what about psychiatrist or social worker in your school? No? Okay, so typically what mental health specialists consider is, to give you an example, there's clinical psychologist, there's a psychiatrist, there's social worker, there's also marriage and family therapist, and there's also psychiatric nurse. And this is just to name a few. There's also a lot of them. What they do is basically they provide counseling and services available. For example, school psychologists, what they do is assess the child's ability and their eligibility for special ed. So they run the test and they will say, okay, this child qualifies special ed. And under the special ed, these are the services your child should get. Okay? And for example, licensed social worker and licensed marriage family therapist, they provide counseling. So if kids on the spectrum or who also has like OCD behaviors or like they have bipolar, school actually can provide some kind of counseling for them for under the licensed social worker or licensed marriage and family therapist. Usually they are the most typical ones. Like for example, you know, like those shooting occurs after like in school, so the school will provide those services for kids to talk to whenever they want to. So that's always available. And under special ed, you will constantly see psychologists or like MFT or LCSW that participating in the child's overall services. They're typically the one who say like, okay, I know these are the resources you should have. Your child should get this type of services versus the other. So that's what they do. Next one is there's an administrative side. Who's interested in becoming like an administrative versus like teaching? You know, like in school, you see your principals, you see your secretary, you see your program specialist, all those people. They are the one that I qualify all under administratives. So there are people who are moving into more into that field. Like if you're the one like who's really organized and can processing a lot of paperwork and know all the rules, this may be something for you though. Because like they are the one who actually mainly in charge of placement of students and services available in school. So for example, if a child needs, let's say the child is moving from elementary school to middle school, and there are three places that both offer, they all offer the same program. Then program specialist or the director will be the one who determine that like based on the needs of the child, I think he should go there. So they are the one who actually make the placement and the services attached under the school settings. So anyone, like, they're actually pretty powerful though. Like, the special ed director basically makes the call of everything. And sometimes they can override what the parents want sometimes. So yeah, if you want to be someone in power and really make a difference, that's maybe something that you want to consider. Yeah. And usually start by program specialists because they're the one who provide the placement, then you move up to become director. And sometimes like the principal in school also has a say for the child's placement. So. Next one is paraprofessional. What paraprofessional does is they're the one who work with individual students or in an individual group. They reinforce the learning and materials usually already implemented by the one I say certified staff. When I say certified, basically means like the teacher has credential, the teacher has to be certified. So paraprofessional works with the teacher works out the lesson plan, paraprofessional carry over with the students. Okay. That's what I did when I first graduated from college. Typically, like without advanced degree, that's probably your first entry door for special ed. So you'll work as a paraprofessional because you're directly supervised by a licensed person or a certified person. So if you work in a classroom, then the teacher is your direct supervisor. If you work in a private sector, then whoever has a license either in mental health or occupational therapist, speech therapist, they are the one who is responsible for you. So you will get your hours that way. You can get direct supervision while you work towards your degree, because without the license, you cannot be the one who actually in charge of the program. So they work closely with teachers, administrative, and other team members. Okay. Any questions? There's also workability program manager. This is by far, I think, the closest thing for people who want to work with high school kids. Okay, so because like us regular kids, even special ed kids, they need to find themselves a job, be a responsible person for the society. So typically, once they enter the high school, then school district will come up with a program that's called workability. So what does the workability program manager does is that they are the one who find their employment goals for the students. Like this one, like those two students are the one with special needs, they work at a pizza shop. And this person right here is their program manager for their workability program. The workability program manager, they go out to find the cohort program who can sponsor this program. They may go to like Ross, Marshalls, and talk to the manager there and say like, do you have availability for my student to come here to work? Basically, this is their full-time job. They learn the skills by doing what they're in school, and eventually they can learn a skill. So typically they find the service industry, or they can work in factory, whatever that fit for their needs. So that's the program manager's job, to find the work that fits the child. And they make the workshops, job clubs, individualized program placement assistance, and follow-up support with the jobs. So sometimes you have to go with your students to see what they're doing and provide training for them. So, and if you like working with high school students, this is really a cool thing. So, yeah. The next one is behavior interventionist. This is the one that I will drag into more detail about, because this is what I do on my daily basis. And since I'm doing the presentation, I got a little more privilege to talk more about what I am interested in. So, what is a program behavior interventionist? They're the one who provide a one-on-one intensive program for behavior therapy for students on the spectrum, which stands for autism spectrum disorder. However, they don't work mainly with kids with autism though, because special ed, as I say, like if they have behavior problem, they qualify under behavior intervention. So it's not just autism piece. So. And one research-based behavior intervention is the ABA, which is called Applied Behavior Analysis. So what this ABA does is it's just a structured teaching that covers like speech and language therapy, social skills therapy, occupational therapy. So ABA is a big umbrella that we, through sustained repetitive teaching and with collaboration with speech, language, OT, social skill, then the child can better formulate their life. I like to think ABA is we change the environment to help the child change their behavior. So, let's see. So, behavior interventionist is something that you can do right after you graduated from college. Sometimes like you don't even need a BA degree. It depends on your funding source. So typically this is also an entry-level job that's really good for kids who just graduate from college. Still figuring out if this is the right job for them. This will be a good starting point. Because like they give you a good one-on-one experience. You're actually directly working with the kids. And you will see all their behaviors, and you will see their growth as well. It's pretty rewarding in the sense that like you're not going to see the difference from one day to another day. However, if you continue working with the student for a certain amount of time, you will see a huge difference from the time you first saw them until like after you finish with them, maybe a year after. Like personally, I have a student like I've been working for like almost 4.5 years now. When I first got him, he was 5. Everybody, including speech pathologists, qualify him as nonverbal. Basically, he would never be able to talk. But right now, 4 years after, he can formulate 4 sentences, tell me, can I have iPad? Still not to the point that like he haven't put his verb in yet, but I'm just so amazed the growth that you can see. However, if you don't have the continuity of the care with the students, you're not going to see the difference though. So this is a job that you need to have a lot of patience to see the difference. So, but as a behavior interventionist, you're the one who has the direct interaction though. So I think that's the most rewarding part because you definitely see the growth. And this is the side that like, this is how typically the session works. Like a behavior interventionist sits right here. They assist the student on the other side. They're working on a puzzle. So she's providing the necessary prompting. Basically, how do I assist him? If he needs help, do I just point? Do I not? And during the whole time, she's collecting data because ABA is research-based and everything is based on data. So if you put the puzzle piece correct, they have to mark correct. There is also board certified behavior analysis, which is myself. What this means is that like we're the one who supervises the behavior interventionist. It typically requires you to have an advanced degree. You need to have your master first, then to get this certificate. And we're the one who design and implement individualized program for the clients. And we're primarily focusing on how to meet the client's full potential through intervention. So it's still a behavior approach. Everything we see is like through behavior. So, and what we see is what we correct. Unlike the psychiatrists and psychologists, we don't see what your mind does. We just see that like what we see, okay, you have a behavior right now. And then how do we correct it? Is it because the environment is too bright? Is it because you want something? Is it because like, you're trying to escape from something? So we don't care. We're like, oh, maybe like the psychologist may talk about like, oh, it's probably because like you had something happen when you're 3. So we don't say what we cannot see. That's the biggest difference. Like behavioralists, we just correct on the behavior that we can see in our eyes. And it is actually currently an international certification. There's like at least 20 countries nowadays that recognize this certificate. It started off in Florida, now it's nationwide and international-wide. And there's a difference between BCBA and BCABA. BCABA is an associate degree that you can get by only having an undergraduate degree. Okay, so if you have a BA, you can apply for BCABA. And you just always have to be supervised by a BCBA, but you can implement the programs however you want. Now, the most exciting part is how to enter the field. So, my first take for you guys will be your field experience study this though. What I mean by field experience study is do tons of volunteer work. I know some of you guys are already working with the kids on Sunday school now, right now, right? So do you guys have experience working with special needs already? Yes? Can you talk about?
You want to talk about it?
Oh. Yeah. Yeah.
What do you
Your experience just by,
Working here?
yeah.
Well, I've worked with a lot of different kids, obviously, and then some of them aren't coming to work. But I don't. It's like sometimes I can see improvement even in just an hour and a half. Like sometimes they start interacting more, they start smiling more, and they like sometimes when they. I'm working with this one kid right now, Lewis. When he first came the first week, he started crying, and he was really upset, and he always ran toward his shoes because he wanted to leave. And now he comes and he just like runs for the swings, and he's really interactive, and he like follows along with the movements, and he smiles a lot more. So it's rewarding seeing that.
Oh, good. Anyone want to talk about your experience working with the kids with special needs? No one? Go ahead.
I guess I've been working with this church group, and then for 4 years now. And then the thing is, I work with kids, but they're actually older than me. Like the oldest one we have is 65 or something like that. But then,
65?
Yeah.
Okay.
But then they all act like 8-year-olds. So that's pretty interesting. And then I just see them as like a family, like a different family, I guess. And everybody there is, we just talk, and it's like I see them as friends and not really as patients.
Okay. Sorry. Okay, Monica.
Okay.
No, like why I want to ask about this is that like all your experience matters. Without doing it, you're not going to know whether this is right for you or not. Like the mom was saying that like you decided you're more determined about this after you work with them even more. So I highly recommend you just go do it. Any volunteer experience that you can get, grab it and do it. Because you're not going to know whether this is right for you or not by not doing it. So we have a lot of people who just be like, okay, I just sign up for it and quit really within 2 months. And it's a really devastating thing for the clients though, because like they have a rapport with you building and you just took off abruptly. So like in order to avoid that, I ask you guys to try it right now. Any volunteer experience that you can, even like the special ed program, like talk with your counselor in school and be like, okay, so do you know anything that's related? Like I got into this field by just joining the teacher cadet program, so you never know what's going to come in your life, so see if it's right for you. The next one is check for prerequisite for each occupation though. So it is true that in order to be like all the speech pathologists, mental health specialists, occupational therapists require you to have an advanced degree. But there are also things like the paraprofessional, even workability and the behavior interventionist. Those are really common entry-level positions for kids who just graduated from college though. So because they don't require you to have an advanced degree, while you work on your advanced degree, maybe this is a really good full-time job for you to try the field. And when I say once you get into college, typically the undergraduate majors that we pick for related field are, the most common ones are the psychology, education, sociology, also sometimes even communication, the mass comm. So those are the typical ones. So, and like when we hire behavior interventionists, we'll ask you, do you have related major that's related you can relate on? And we also ask you, have you worked with kids before? Those are the common 2 qualifications that we ask. So those will be the prerequisite. And in order to do more stuff, like if you're interested in designing your own program, then advanced degree is typically required. almost like all the stuff like I described, like speech therapists, occupational therapists, physical therapists, they all need a master in order to carry over, and the master will be in their specific field as well. So when I say specific field, like speech therapists, they need to get a degree in communication or speech. Occupational therapists have their own master program as well, and I believe mental health specialists also has their own program. That's why they're licensed. So, and there is a difference between certification versus licensing that I want to describe to you about. So, licensing, typically most of them are state licensed. What that means is that like once you finish your program, you have to take a state licensing exam to get yourself licensed. And it typically requires you to work very, very long hours. Like you need 30, probably like anywhere between 1,000 to 3,000 hours in field experience in order for you to sit for the exam to be licensed. So, certificate is usually not by state. It's actually an organization that will certify you. So it doesn't weigh as much as a license, but right now, currently in the ABA world, there's actually no licensing. So the most you can get is the certified behavior analysis, as I say before. The good thing about certification is it's world, national-wide, and international-wide. You can bring it anywhere you want. In terms of licensing, because it's by state, if you only get licensed in one state, you're not going to be licensing another state or another country. You have to redo this over and over. Certificate carries with you forever, anywhere you go. So, that's that. And I want to say thank you for the presentation. I want to open up the rest of the time for you guys to ask me questions that's specific about yourself. And what do you plan on doing using your degree in the future? Nobody has anything? So yeah. Tiffany, do you have something?
When I used to volunteer at elementary school, I saw a teacher, but sometimes I would see there's a lady who sits next to the kids.
Okay.
And I do not know that kid, which kind of special needs that she has, but she would sit with the kid and, control his behavior, or sometimes she would do some teaching as well. What kind of job is that?
I think it sounds like a paraprofessional or a classroom aide. So, because like it's one-on-one, right? She's only working on with that child.
Right. Within
Okay.
the classroom.
Within the classroom, but is she only focusing on that child?
Right.
Then it sounds like it's a paraprofessional position. Yeah, paraprofessional, basically you follow the teacher. And in classroom, especially for special ed classroom, the teacher usually have several classroom aide. Classroom aide is basically equivalent to paraprofessional, where they follow the teacher's instruction, either working in small group or a one-on-one setting. So if the teacher give out an instruction like do page 6, there may be a child that cannot focus and cannot do page 6. That's when the paraprofessional go to the child, be like repeating the instruction, turn to page 6, I'll work with you, because the teacher cannot wait. If you have the whole class, there's no way you can wait for a certain period of time. So like they pull aside and do individualized instructions for the child. Yeah.
What kind of qualification?
Typically for school district, I can tell you like you just need, I believe a BA is sufficient enough. Sometimes like they don't even need you to have a BA. You have to be like high school equivalency. So they don't, it's a pretty entry level position, so they don't require you to have an advanced degree for that one. So
But nowadays, do the school district hire any parent
professional?
full-time?
Yes. I think they still do, yeah. Because like, just give you example, every 8 minutes, there's one child that being diagnosed with autism. So wherever our conversation occurred, there is already so many child being identified already. So like special ed is never going to go away. However, every country does it a little bit differently though. Like I know in Canada, they actually don't have such thing called special education. I personally, when I learned in grad school, I really don't like the term special ed because like I feel like it's really to separate them from being normal. And US has such a beautiful program that like just regular ed and special ed are equivalent. But I know Canada, what they do, everything is inclusion. What that means is there's no such thing as regular ed or special ed. Everybody is in the same classroom. I don't care you have autism, I don't care you have physical disability, you're in a wheelchair, you are in the same classroom as anyone else. They may provide you with special support, but we don't put you in another classroom. Whereas here, the line is very distinct. What happened in regular classroom is completely different than what happened in the special day classroom for special ed. So that's another difference that I want to mention. So, anything else? Yes.
怎么都是我的问题？你都没有问题吗？
有，你先问。
哦，你先问。
哦，我只是用中文讲哈，就是说你这个 program 你是到多大的小孩？因为有的人是到很大的，他都没有办法改变，然后那这些人要怎么办？就是例如说他已经30岁、50岁，让他碰到的那一些，那他们
Okay.
who will work with them?
Okay. So that's a really good question, and in order to answer that, like there will be times that like the whole goal of this behavior intervention is to help them meet their potential, as I say. But everybody's potential is different. Okay, maybe there will be someone like their mental equivalence only until 8. They can only learn what 8-year-old do. Currently, United States actually has a really good system for those who needs the care. So for the one who's already in adulthood, 30 years old above, parents can make a decision if they can no longer take care of their own child anymore. Maybe your parents, if you're 30, your parents may be 60 or 70. That's when there is a special placement called either a group home or you can live by yourself with assisted living. It's called assisted living. What that means is that like, for a group home is you actually live with other people who are on the similar diagnosis with you. So there may be like 4 men living in one house, but there will be someone who is with them 24 hours. And they rotate. There will be staff assist them. So there would never be a chance that they will not be supervised. Okay? And there will be someone who maybe on a higher side, he can actually live by himself. But there will be just people checking on him all the time. So the reason why we need a checkup is because like what if they got tricked? Because like they have their own money, the government stipend them there every month, so they actually got money from the government. And they need to learn how to utilize their money. How do I make a living? How do I cook? They do take care of themselves, but you just need someone to assist them with, let's just like opening your bank account or things like that. So that's where the future route for those who actually will not be able to live by themselves.
And these people that check on them, are these people all employed by the government?
It depends.
The money comes from where?
The money comes from the government. The group home and the assisted living, all the money is coming from the government. However, they may just be a contractor where they're not really directly employed by the government. Typically, the way it works is like the group home has a contract with the government, and the group home is registered. Like this is a licensed, legitimate place. They hire their own staff. They pass the background check. Typically, most of the time group home has a lot of the ratio of the staff there is more men than women. Reason being that like for group home they may have like situations that occur, like the client get violent or anything like that. So typically they will hire more male than female. But I do have female workers as well because they are female only group homes. So for those scenarios, it'll just be female staff. But typically, they don't need to be hired by the government. They can just be hired by the group homes. And the certification usually just either an undergrad or like even I've seen someone with just a GED. It more matters that you know how to handle the situation. You have to be able to remain calm under all times because people may be missing or something like that. But you'll always be supervised by someone though. Typically a group home has like some, either a social worker or a psychologist, psychiatrist that like go out to check on the staff. But the staff itself who work one-on-one is like another paraprofessional. Yeah.
你可以谈一下那个 physical therapist 吗？像什么样的人比较合适当 physical therapist？ 不是 physical， I mean occupational therapist。
Occupational therapist。
比如说什么样的 strength 或者有什么个性的人
？Okay. So the occupational therapists I met, they're typically really outgoing, but that's just my experience, so I can describe to you. They typically knows, they can pinpoint to the most detailed things about that client. Because what they need to do is like they need to evaluate the child by the way they walk, by the way they sit, by the way they grab things to determine whether this child has deficits or not. Okay, so they typically need to be really fine-tuning into finding the most detailed things. And they have to be the one who can come up with like a situation by themselves and resolve it really quickly. What if the child is flopping on the ground? You need to be able to engage them right away. And also, you need to have a really good rapport with the parents, though. It's not just for occupational therapists, but it's for everyone else. But reason being that, like, typically occupational therapists, they only work once a week with the client. Everything else is carried over with the parents at home. You need to, if you only do it once a week, nothing will work. So you need to be able to have a good rapport with the parents, have them follow through with what you're doing. And come up with the plan to support a child, like maybe providing a sensory diet. What that means is that that's something that like parents have to do every day with the child. You have to be able to assign the parents homework. You need to do this on an ongoing basis. So those are the ones that I think good description of what occupational therapist is.
So the special education only work from, say, from birth to like high school kids?
Okay, so there's difference when I say like, of course today we're talking about special education. So education is different from the private sector. So under education, the child goes until 18 and then like there's 4 years of transition year. What that means is that like the child can actually stay in school until they're 22. Okay, after that, school district no longer takes care of the child. So the parents can choose to keep the child at home or go register him under a daycare program. There's day program there for the clients to do. What the day program does is, as I say, similar to the workability, they give you skills that you can do. And it's a class, like they occupy your daytime, so you can go home after the day program ends. So that's for education field, but for non-public sector, there's no ending point. Like we have clients who's from 18 months all the way up to like 30 or 40. So there's really no ending range of like when the behavior intervention should be stopping. So as long as we see there's a change, we're going to continue. Yes. Okay. Yes. Go ahead.
我刚才跟你说我在Dianza College 修那个
Early
childhood 的他那个 certificate 的名字叫 Early Intervention Special Education。那他在那个 department 大部分人都是要去做 preschool 的老师的。Yeah， 只是 personally I've never seen any preschool， 就是因为我真没看过 any preschool that specifically 就是 serve those special need kids.
Okay.
所以我不知道我拿这个 certificate 之后，我出去
你想做些什么 ？Can I ask？你觉得你最喜欢是跟 kindergarten 在一起，是不是？你刚刚说。
就是 preschool、kindergarten 或是 special need。
OK， 你可以考虑去 regional center， 或者是到我们现在很多 MPA program， 就像我们公司那种 non-public agency。We're looking for people with an EI certificate, early intervention, because that regional center. Okay, regional center is the department that serves all people under disabilities. They are governed by the Department of Developmental Services, called DDS. So they got funded by DDS. They serve all the kids, or not just the kids, all people who have disabilities. And they're doing at home and in the community. They take care of the period when the school district does not take care of. What that means is from 0 to 3, they take care of that, because typically the child goes to school district for preschool program if they have problem at 3 years old. After 22, regional center, the child comes back because regional center have to take care of, because the school district only in charge from 3 to 22. So afterwards, regional center have to find a day program for them to place. So for the early interventionist, your job is actually to rule out which child that you see under your qualification, be like which child has difficulties, who may have difficulties. The whole point right now is not just it's the key is intervention. 你要先防御 then so that you have to prevent it from happening from the starting point. So regional center really focusing on the EI part. So basically, sending out people like you, go to the house. If the parents say, my baby's 2, is not talking, can you come? And you can see is this really something that we need to intervene right away? Or, there's something you can work on. Maybe it's a parenting issue, we don't know. But your certificate will be helping for that piece. And our program also have an EI program that we're focusing on sending out specialists like you, who basically talk and screen the child, be like, okay, is this something that we need to be taking care of, or whatnot. So.
certificate 只是 for preschool level 的小孩。
Doesn't cover the 0 to 3 piece? 它没有包含其他的吗？
没有，因为它这个 child development 就是做 early childhood education。
只有 preschool 吗？ That seems to be kind of odd, but we can talk about it later. But the only preschool? So I have a problem believing that, but yes.
Going back to the music theory, therapy thing, is it the major for music, would it be only for classical or contemporary also?
I think it should be both, and to be honest with you, your undergrad usually just has, I believe it's you major in music. I don't think there is any difference for after that. In order for you to become a musical therapist, you need to go into the grad school level and find one that actually support that. But what you focus on is actually not the most important thing, though. So, yeah.
For people who are considering this field, I think it would be very helpful for teenagers to follow a mentor or shadowing, to see what the professional actually do. But where can we go to get help, to find mentors? Who has connection with this?
Mentor program. Let me see. Okay. Usually you start off with your high school. I remember I joined a mentor program when I was in high school, but I don't know if they're still available. Do you guys know? Check with your career department. Do you guys know who is in your career department, who you can talk to? More or less? Yes. Some people nodding, some people is I don't know what you're talking about. So if that's not a goal, then what I suggest you is interview the person, Google it, and then this is a perfect opportunity. Before I leave today, I will be more than glad to leave all my contact information with all of you. And if you have any question, just talk to someone, because I know this is really difficult decision to make, like whether you want to go into this field or not, because you don't know this is right for you, you want to see it. So I totally understand, and like the mentorship program, I think it will be really valuable for people as well. So I was lucky enough that I did have a mentor when I was working in Oakland Unified School District. The teacher was basically my mentor. So I would say that like talk with someone who actually like already in college right now or already into the field, and just do information interview with them. Believe me, people love to talk to you about themselves. So if you ask them questions about their work, they can go on and on and on. So don't be afraid, just say that like, I want to major in special ed, I found your information on, and the best way to start is finding your alumni, okay? So just say that we went to the same school, I know you graduated early, I saw you do you guys use LinkedIn? Probably too early, huh? No. So like, LinkedIn, but it's for professionals. So, but then like, if you hear someone who's in the field, then just do information though. Shoot them an email. Like, can we talk? That's basically the first starting point. I don't know there's specific program design that's guardian for this right now, but I know our company will come. We do high school volunteers from time to time in our office. So if you're interested in, come talk to me after this. So yeah.
Thank you.
So yeah. Okay, so if you guys have no further questions, we can thank you for coming today. And then I'm going to leave my card here. So please, if you have any questions, let me know. And if you guys want to learn more about other things, any topic that you want to listen to more, let Cindy know, and we can do another seminar that targeting your specific needs, for sure. So yeah, thank you.
Thank you.